sleep apnea that starts from the hypoxia that leads to the cyanosis and the secondary polycythemia. And you see that she has got the pitting edema. And the most important complications that I found, good morning. My name is Dr. Sawan. I'm the PACES candidate here today. I've been asked to examine your chest. So ma'am, what I'm going to do, I'd like to have a very good look first and then feel, then tapping and listen to your chest. So do you have any pain right at this moment at your chest? No. All right. So during this procedure, if you have any of the pain and discomfort, just let me, I'll stop at that moment. Is that all right? So yes, my dear doctor, listen very carefully. After entering the room, the respiratory system examinations, that you enter in the room, that lady is an obese lady, you see, and having some of the breathless at rest. And she is having breathlessness at rest. So yes, my dear doctor, listen very carefully. Enter in the room that you need to the G-band practice, the greetings, introduction, instruction, pain, position, and pose. So up to the position, here's the 45-degree angle. She is here. And also the poser means the exposer, means you need to expose the lady to examine the chest. So I did listen very carefully. Is one of the important tips and tricks that the cases that we already learned and the approaches of the respiratory system that we studied for the symmetry, epidiameter, and then crackles. Asymmetry is scar, trachea, and asymmetry with no scar, then the Darwin percussion. Yes, my dear, this is another variety of the case that I'd like to show. Yes, this is not a very usual case that will be given to your exam, but that's why I'd like to show. If you just see for the first time, and if you get this case in your exam for the first time, you'll be able to produce this case, my dear. It's a very important case and not that common, but yes, 1 out of 20 candidates will have the chances to get the case like her. And she is obese, having the breathlessness right at this moment. So yes, my dear doctor, listen very carefully. The obese with the breathlessness at rest and at the bedside that I have seen, there is a machine. We call it the CPAP machine, the continuous positive airway pressure, the CPAP machine. And CPAP machine at the bedside, obese lady, having breathless at rest, and having some of the plethoric faces that I've seen, and also the plethora that I can see in the palms as well, and also some of the blue tips of the fingers that I've seen. So putting all them together, so the diagnosis, we call it the Obesity Hypoventilation Syndrome. What I said, Obesity Hypoventilation Syndrome, means the OHS. Another name of the OHS is the Pickwickian Syndrome. Yes, my dear, the OHS or the Pickwickian Syndrome. So I made the 3 important things that you need to remember, my dear. OHS, that you can remember, the 3 triad of the diagnosis of the OHS, the next to the diagnosis. So definitely the Obesity Hypoventilation Syndrome, the obese lady or obese man should be there. And the OHS, once again, the O4 that you need to remember, the obstructive sleep apnea. So yes, she has got the obstructive sleep apnea, which is treated, and she has been treating with the CPAP machine right at the bedside. So this CPAP machine is a diagnostic at the bedside. This lady has got the obstructive sleep apnea hypopnea syndrome, or we call the obstructive sleep apnea syndrome. And this CPAP is given to the patient usually difference that we need to do the full polysomnographic test, and that will allow the adjustment of this machine and how the machine can be used based on the full polysomnographic test idea. So the bedside, the CPAP machine is the diagnosis of the obstructive sleep apnea syndrome. Immediately after that, the O for obstructive sleep apnea syndrome and the H for, that is very much important, my dear, there is the hypercapnia. So the evidence of the hypercapnia at the bedside is an important findings to make the diagnosis of obesity hypoventilation syndrome. So O for obstructive sleep apnea as evidenced by the CPAP machine at the bedside, and H for hypercapnia. So the hypercapnia bundle bags that we need to look for, the pulmonary edema, warm hands, and the bounding pulses and the flaps altogether. So these are the things that we need to look for. And last, for the S for, yes, my dear, S for that you need to remember, the restrictive, yes, there is an S within the restrictive word. So the restrictive lung defect, RLD on the pulmonary function test, that you need to do the pulmonary function test so that we can get the restrictive lung defect. But at the bedside, the two important things, the obesity hypoventilation.
First time in the world. Most effective course. MRCP UK PACES Paces, a complete online course. 5 complete stations, 8 encounters, 32 modules. More than 100 history cases, communications and skills cases. More than 200 clinical cases and clinical approaches. More than 400 presentations. 500 plus hours video lectures. 1000 plus notes, SS boxes, SS tips and tricks, questions and explanations. One of the best PACES mentor, world-famous experienced, skillful and expert MRCP UK teacher. Learn with Dr. Sumanta Kimar Saha, Chairman and Course Coordinator of SS Academy.
The best and the best and the best course ever you will experience in your whole lifetime. Hyperventilation syndrome, or for obstructive sleep apnea, that evidenced by the bedside CPAP machine, and H4, that is the hypercapnia, the clinical bundle bags that we are looking for. Yes, hypercapnia syndrome means the hypercapnia syndrome includes that I said that the pulmonary edema, warm hands, bounding pulses, the flat smiling. So we will see that in her case, the findings that we are getting or not. So yes, my dear, the obstructive sleep apnea hypopnea syndrome as O for OSA, or we call it the OSAS. The obstructive sleep apnea hypopnea syndrome. So some of the important features of the obstructive sleep apnea that we need to look for clinically at the bedside. What do we need to look for? Sometimes the crowded tonsils, and here the maxillary and mandibular hypoplasia. So what I say, mandibular or maxillary hypoplasia, and macroglossia. Yes, my dear. And also the crowded tonsils, and sometimes the Marfan syndrome. So these are the predisposing risk factors. And along with the collar size, yes, more than 17 to 18 inches or 17 inches. So these are the features basically we are expecting for a patient with the obstructive sleep apnea hypopnea syndrome. So what I said, just remember, my dear, what I said, the maxillary or mandibular hypoplasia, and then macroglossia, and the crowded tonsils, and the neck collar size or circumference more than or more equal 17 to 18 inches. And also the Marfan syndrome, the Marfanoid habitus. So these are the risk factors to develop the obstructive sleep apnea syndrome. So when there is an obstruction, definitely there is an oxygen, means the partial oxygen getting down. There's a hypoxia that leads to the cyanosis, so we need to look for the central cyanosis and also the peripheral cyanosis altogether. And then because of the secondary polycythemia, that leads to the facial plethora and sometimes the plethoric complexions. These two important complications that we can get, and also the third complication, the hypertension, my dear. And the hypertension, systemic hypertension, that leads to the sometimes the stroke and maybe the congestive cardiac failure, the left heart failure as well. And also the pulmonary hypertension that leads to the right heart failure. So what I said, the hypertension, both hypertension, systemic hypertension and pulmonary hypertension. Systemic hypertension leads to the left heart failure, and pulmonary hypertension that leads to the right heart failure. So we need to look for the features of the systemic hypertension, left heart failure, and the pulmonary hypertension, right heart failure. These are the two important things that we need to look for at the bedside. So summarizing all together, the OHS, O for obstructive sleep apnea hypopnea syndrome, that needs some of the structural deformities that we are looking for, the maxillary or mandibular hypoplasia, large tonsils, crowded tonsils, large tongue, the macroglossia and the crowded tonsils, and the neck circumference. And second important, the complications of the obstructive sleep apnea, that is the hypoxia that leads to the cyanosis, and also the hypoxia leads to the polycythemia, so the plethoric phases, and then the complications mainly of the obstructive sleep apnea is the hypertension. And hypertension means the systemic hypertension that leads to the left heart failure and lungs crackles, and also the pulmonary hypertension that leads to the PHT, leads to the right heart failure. RHF, the raised JVP, H for hepatomegaly, F for foot edema. So these are the things that you're looking for. And second component for the O, then H for hypercapnia. So we are looking for hypercapnia bundle packs. And as for syndrome, then I'd like to do the pulmonary function test to look for the restricting lung defects. So now we need to look for the hands examination first. So ma'am, could you please show me your hands? Yes. So yes, it's because the respiratory system that you're starting the examination, you need to see the clubbing. So there is no clubbing, no liquidic staining, no wash here. Turn your hands like that. Yes. You need to see the hands that she has got the pulmonary erythema. And also the tips of the fingers, the bluish, is the cyanosis as well. So see the pulmonary erythema. You see the pulmonary erythema, compare with my own hands. She has got the pulmonary erythema, and you can feel the warm hands. Warm hands. So the pulmonary erythema, warm hands, and feel the pulse. Feel the pulse, there's a bounding pulses. And then we need to look for the flaps. So you see some of the flaps that we can see. She has got some flaps in her both hands, so she has some carbon dioxide retention features. You see, my dear, the tips of the fingers having the bluish color. You see the compare with my own hands. So the bluish tips. So she has got the cyanosis as well. So as I said, the obstructive sleep apnea leads to the hypoxia that leads to the cyanosis. Yes. And this cyanosis and also the secondary polycythemia, that the plethora, pulmonary erythema, and the carbon dioxide retention findings that we found. So we found the cyanosis, we found the pulmonary erythema, warm hands, and the bounding pulses, as well as the flaps. So these are the 4 important findings of the carbon dioxide retention. Hypercapnia, one of the important components of OHS, means the Obesity Hypoventilation Syndrome. So seeing on her face that you see that her face also looked to be plethoric face. So here's a plethoric face. So you see that the facial plethora, and of course it's a secondary polycythemia, and also she has got you see the lips are really bluish color. So her lips are bluish, means that she is cyanosed as well. You can see the tip of the tongue as well. So stick your tongue out for me. Tongue. So yes, the tip of the tongue as well as the bluish color, so the central cyanosis is also present. So you see the complications, as I said, my dear, the obstructive.
First time in the world. Most effective course. MRCP UK SS PACES, a complete online course. 5 complete stations, 8 encounters, 32 modules. More than 100 history cases, communications and skills cases. More than 200 clinical cases and clinical approaches. More than 400 presentations. 500 plus hours video lectures. 1000 plus notes, SS boxes, SS tips and tricks, questions and explanations. One of the best PACES mentor, world-famous experienced skillful and expert MRCP UK teacher. Learn with Dr. Sumanta Kimar Saha, Chairman and Course Coordinator of SS Academy.
The best and the best and the best course ever you will experience in your whole life, my friend. Sleep apnea, that starts from the hypoxia that leads to the cyanosis and the secondary polycythemia, and then hypertension. Hypertension, there is the systemic hypertension that you need to tell to your examiner that I'd like to measure the blood pressure of this lady, and now that the hypertension, the pulmonary hypertension, there is a PST that complicated by the right heart failure. So you can see the JVP here. So you see the JVP is raised here. So you see the JVP is raised. JVP is raised, you see. So the raised JVP, you see that this is the JVP here. So I can hold it here. So this is the raised JVP. So raised JVP, then the hepatomegaly, that you need to put the hands on the right upper quadrant, and then we are expecting to the leg edema. I'm not putting the hands on the abdomen because this is the respiratory system, but you need to put the hands onto the legs to get the leg edema, my dear. So let's see the leg edema first. So now you see that the leg edema that we need to look, and you need to tell her and put the hands I press over there. Do you have any pain at your legs? No. And you see that she has got the pitting edema. So if you come closer, come close, and you can see the pitting edema here and also the pitting edema there. So bilateral pitting edema, leg edema. Yes, the diagnosis of the right heart failure, raised JVP, and the leg edema, the right heart failure, the complications of the pulmonary hypertension. And now we are looking for the lungs crackles, my dear. Take a deep breath in and out. Once again. Once again. So she has got the bibasal inspiratory crackles that are consistent with the left heart failure. Nothing but the complications of hypertension, my dear, of obstructive sleep apnea. You see that she has got also some of the important features, the maxillary hypoplasia. Yes. And also the mandibular hypoplasia as well. So these are the two important findings that we have seen, the maxillary hypoplasia and mandibular hypoplasia. These two important findings are suggestive of risk factors to put her to develop the obstructive sleep apnea syndrome. So you see that the neck collar circumference is more than 17 to 18 inches. So she has got the 20, so the neck collar size. So these are the three important risk factors, that the maxillary or mandibular hypoplasia and also the neck collar size. These three important risk factors put her at risk to develop the obstructive sleep apnea syndrome. Yes, my dear doctor, immediately after that you finished your examination, you need to wash your hands, of course. Thank you very much. Thank you once again, and you can handshake with her. So yes, and you tell her that you have done really excellent for me. And saying that you have finished your examinations, my dear. And even after that, you wash your hands once again. Yes. And give the clothes back and give the thanks, and saying that you have done really excellent means that the full environment will be excellent, my dear. And immediately after that you need to tell the sir, I'd like to finish my respiratory system examination to check the bedside spirometry and also the bedside arterial blood gas analysis, and I'd like to finish my full examination to see the observation chart, especially the pulse, temperature, respiratory rate, blood pressure, oxygen saturations, and also I'd like to do the urine dipstick for the sugar, protein, RBC, nitrogen. Saying these three important bundle bags mean that you finish your examinations and you'll get the full marks in your examinations, my dear. So my dear doctor, listen very carefully. What I have shown in her case, basically, I have not examined the respiratory system fully here, but you need to do that. You need to expose the lady fully, and you need to start the examinations from the trachea, then the CP and BSB all together, with the chest expansion, yes, the percussion note, breath sound, and vocal resonances on the front and back all together. But I have not done here because she has no other findings except the bibasal inspiratory crackles. So that's why I just avoided here. But with the positive important findings that we found that should be discussed in that way. Now I'm presenting my case, actually in her case. What will be the presentations, my dear? As I said, the Pickwickian Syndrome and the Obstructive or the Obesity Hypoventilation Syndrome, OHS. Well, I say that the Obesity Hypoventilation Syndrome is not a very common case, but it can be a case. One of 20 candidates will have the chances to get the case, my dear. So the presentation should be the way, my dear, I'm saying. My clinical diagnosis of this lady, of this obese lady, is Obesity Hypoventilation Syndrome or Pickwickian Syndrome, as evidenced by O4 obstructive sleep apnea, as evidenced by the bedside, the CPAP machine at the bedside. And also she is breathless at the rest. And also I have found this lady has got some of the risk factors for the obstructive sleep apnea. As I found, she has got the mandibular and maxillary and mandibular hypoplasia, and also the neck collar circumferences more than 16 to 17 inches, and this is something like that more than 20, and I found that in our case that 20 inches. So along with the risk factors with obstructive sleep apnea, obstructive sleep apnea is complicated by the hypoxia that is evidenced by the central and peripheral cyanosis, as evidenced by the fingertips as well as the tongue having the bluish discoloration, and also the secondary polycythemia that leads to the plethoric phases. Along with the risk factors and the complications of the hypoxia, that's with the cyanosis and the secondary polycythemia.
First time in the world. Most effective course. MRCP UK PACES, a complete online course. 5 complete stations, 8 encounters, 32 modules. More than 100 history cases, communications and skills cases. More than 200 clinical cases and clinical approaches. More than 400 presentations. 500 plus hours video lectures. 1,000 plus notes, SS boxes, SS tips and tricks, questions and explanations. One of the best PACES mentor, world-famous experienced skillful and expert MRCP UK teacher. Learn with Dr. Sumanta Kimar Saha, Chairman and Course Coordinator of SS Academy.
The best and the best and the best course ever you will experience in your whole life, my friend. And the most important complications that I found, there is a pulmonary hypertension as complicated by the right heart failure, as evidenced by the raised AVP and the legatum. But I'd like to complete the examination to see the cardiovascular system, to look for the features of the pulmonary hypertension and also the right heart failure. As because I would expect the PH means the P for P2, loud P2, H for heave means the left personal heave, and T for tricuspid regurgitation, pansystolic murmur at the left lower sternal zone, then increased with the inspiration. So these are the findings that I found, and also I found the complications of the hypertension at evidence, which is the left heart failure, as evidenced by the lungs crackles, biversal inspirated crackles that I found. So I found obstructive sleep apnea. She's on treatment as by the CPAP machine at the bedside, and the risk factors, the maxillomandibular hypoplasia, and also the neck collar circumferences more than 16 to 17 inches, and also complicated by the hypoxia that leads to cyanosis and secondary polycythemia, and also the pulmonary hypertension, right heart failure, and also the hypertension, congestive cardiac failure with the left heart failure as well. And next to the obstructive sleep apnea, the second component, the obstructive or the obesity hypoventilation syndrome, the H4, hypercapnia, as evidenced by pulmonary edema, warm hands, and the bounding pulses, and also I found the flaps at the bedside. These are components of the hypercapnia. And the last component, the S for syndrome, but I said that yes, the restrictive lung defect at the pulmonary function test. So I'd like to do the pulmonary function test fully to see the obstructive restrictive lung defect as evidenced by the FEV on FVC ratio that is more than 80% that I would expect. So this is all about the clinical diagnosis, the Pickwickian Syndrome and the obstructive and the obesity hypoventilation syndrome. So here's my dear doctor, this obese lady having the breathless at rest, and you enter in the room, you have seen the CPAP machine at the bedside. So please think about the OHS, my dear. It's the obesity hypoventilation syndrome, or the Pickwickian syndrome is a triad of O for obstructive sleep apnea, H for, as I said, the hypercapnia, and S for syndrome, there is the restrictive lung defect on the pulmonary function test. I hope that, my dear, putting all them together, you enjoyed it. I hope that you learned a lot, my dear. Thank you very much.